Get copies of all of your medical records that for any test you've had, and especially for any tests you have going forward. Get copies of these, read them, make sure you understand them, and ask questions if you don't understand them. Take all of these records and put it into a notebook on a chronological order. This way you can always go back and re-look at something if there's a question, and then if you want to go on and have a second opinion, you already have all of your medical records gathered and in one place. You now don't have to go around and try to gather them and wait 2, 3, 4, or 5 weeks. You have them. So that's important. That binder is going to become your Bible going forward. And again, it's an opportunity to ask questions when you go back over these tests. You can certainly bring some of these tests, if you don't understand them, to a support group, but most important, ask the doctor. Well, what does this mean? This is out of the normal range. Is this something I need to worry about? Why? Why not? How is it going to affect me? Keep asking those questions. The federal government has some great opportunities to learn about cancer. I always recommend that someone gives a phone number of 1-800-4-CANCER. That's the number 4, CANCER. Go to lectures. If you're in a bigger city, contact the hospitals and find out if they have any support groups, if they have lectures where people are going to come and talk about what they do. You need to become an expert on prostate cancer. Never discussed, but if you're a younger man and you're not 190% sure that you're never going to want another child, before you do treatment, think about banking some sperm. Because once you have a treatment, you're not going to be able to have children. And it's a small investment, and it's well worth it, and no one ever recommends that. Go to the web. We all do that without my having to tell you, but what's important is how to understand what on the web is legitimate and good and what isn't. So when you look at a web page, look at, usually if you click the About section of it, it'll tell you who's sponsoring that web page. Is it a pharmaceutical company? Is it a advocacy group? That'll give you an idea as to whether or not there's a bend to what they're recommending or they're saying. Look to see how old the postings on the web page are. In prostate cancer, things are changing relatively quickly, and you want to make sure that the information you're reading is contemporary. There are a number of online support groups that are excellent. Male Care, the organization I work for, we run an advanced prostate cancer support group that's international in its composition. We have a group for men who are diagnosed under 50. We have a group for men who are gay, and there's a stack of them. But there are also other organizations that have similar types of services.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.